All right. Thank you, guys. So, hi, I'm Jeff Blackwood with New Frontier Mobile Diagnostics, and I founded the company to address access to care and health equity issues for people that are in healthcare deserts and rural communities that don't have access to rural diagnostics. So with the company, though, you may notice a little bit of a underlying marketing theme that I have for it, and that's what would Star Trek do? I grew up watching Star Trek reruns. You know, one of the cool things about it, though, was the medical technology that they presented in the show. Having people with the ability to lie down or to wave an instrument over them and look inside their body and tell what's wrong with them was something they presented on the show. The thing is, we have this technology today. Diagnostic ultrasound, by simply touching a probe to the body, can diagnose conditions of all the soft tissues of the body. So everything from an echocardiogram for the heart, vascular studies for peripheral artery disease, diabetes, and then all the way to the traditional OBGYN stuff that we're all used to. The challenge is we've built barriers to this type of imaging. We've made it hard for people to get this basic level of diagnostic care because we've concentrated 90% of diagnostic imaging in hospitals and imaging centers. So what that means is for people in rural locations, especially in Kansas and Missouri, where we've lost 10% of the rural hospitals in the last 10 years, it means we built these barriers, long drives, high costs for services, and then long scheduling delays just to get basic answers about your diagnostic condition. Add into that COVID. When COVID occurred a couple years ago, we saw a drop of 64% in the diagnosis of new heart disease cases and 36% in most cancers. Why is that? Not because of any miracle cures, simply because people were too afraid to go to those hospitals to get the diagnostic imaging they needed. That doesn't mean their heart disease went away. It just got worse because they didn't get it diagnosed early enough. Well, New Frontier was created to break down those barriers. What we do is we have portable equipment, all GE machines that we take out there, and our sonographers are all hospital-trained sonographers that can go on-site. Anywhere that we can get electricity, an exam table, and patient privacy, we can set up essentially a pop-up radiology department there. So what that allows us to do is go to doctor's offices and go to clinics that are close to where those patients are located. So they don't have long drives. We don't have the overhead of a hospital, so we're able to offer it at an affordable rate. And then finally, we're able to get them in really quickly, usually within a week from when they originally send us the order. It's truly tech-enabled care because we're taking our machines out to those facilities. Everything is uploaded into our cloud-based PAC system, which is where all the pictures are stored. And then ultimately, our physicians are the ones that are reading it, and within 24 hours, returning a report back to those originating physicians, letting them know whether there's any condition for that patient. So we have some complementary services that allow us to work across the entire healthcare spectrum. For hospitals, and especially those rural hospitals that may not be able to afford their own imaging departments, we provide specialty staffing of sonographers through our Share a Sonographers solution. But for the remainder of those facilities like clinics, care facilities, doctors' offices, and even with telehealth providers, we're able to offer on-site imaging, taking our systems out there to those locations and meeting with patients where they need to be met. Right now, we have 9 sonographers covering a 26,000 square mile area from Jeff City to basically St. Mary's, Kansas, just past Topeka. And our plans are for growing out into other locations throughout the region, covering the entire states of Missouri and Kansas, and then ultimately getting down to areas like Oklahoma and Texas. So what do we need? What are we looking for from folks? Obviously, growth funding. We're looking to hire 3 to 5 additional sonographers to add to our current team of folks. And with that, our hope is to get to 3 additional markets this year and grow to about $2.5 million in revenue. We're looking for clinical contacts. Any clinics, doctors' offices that want to have their patients be able to be met at that location, we're looking for contacts with those too. Hospital systems. We're currently working with St. Luke's, University Health, most of the HCA locations here in town. If you go there, you're likely to run into our sonographers. But especially when we get into rural locations like Cameron, Lexington, working with folks out in those places too. Those are contacts we could use. But then finally, our research contacts. Looking for folks that are interested in doing outcomes research and health equity or access to care, especially in areas like maternal fetal outcomes, hypertension, cancer detection, and then diabetes management. These are all areas that we can touch on as a company. We have data collection tools that we can go out and get information with these populations. So in the end, Our goal again is to improve access to care and health equity for patients across the Kansas and Missouri areas, and hopefully regionally after that. And I look forward to answering any questions you guys may have. Thank you.